We want to talk a little bit more about one very serious issue surrounding the pandemic. The U.S. Surgeon General has issued a new advisory on a growing youth mental health crisis, warning that depression and anxiety symptoms in young people have doubled worldwide during the pandemic. ABC News medical contributor and emergency physician Dr. Darian Sutton joins us with the details. Good morning, Dr. Sutton. Good to see you on this important subject. Tell us what's new in this report and why it's troubling.
Oh, good morning, Terry. So there's some concerning signs that we're seeing in trends of adolescent health. What we know is that children, adolescents, and young adults are facing some considerable challenges that seem to be exacerbated by the pandemic. And in this recent report, it actually looks at more than 80,000 youth globally, and it found some disturbing statistics, some of which include symptoms of depression and anxiety have doubled more than twice during this pandemic, with 25% of youth experiencing symptoms of depression and 20% experiencing symptoms of anxiety, and ER visits for suspected attempts of self-harm have increased by over 50% for young women. So it's an important topic to talk about, especially now.
It is so difficult to socialize in the pandemic, and that is the peak age of socialization. And if they're only on their phones socializing, that might be a problem as well. But this report also lays out disparities in access to resources for young people who need them. So what needs to change there?
You know, that's actually the more concerning thing that I see in this report. These disparities are some of which reflect what we see in adult populations. They actually identify those that are vulnerable, which include but are not limited to young children of color, Indigenous Americans, as well as Alaska natives, and young people who identify as LGBTQIA+. The hope is that sharing information like this will not only help shed light on this topic, but to be honest with you, increase funding to mental health care services and hopefully provide access to these communities in need.
Because it is such an important need, and we need to get those resources out there. Now, a couple of questions. First, have you seen in your own practice, I know you're an emergency physician, but evidence of what you'd say is an increased problem with young people and depression or suicidal thoughts or attempts? And what should parents watch for if they're concerned?
You know, well, there's a couple of discussions. Well, first off, to answer your first question, yes, I have seen a considerable increase in the amount of psychiatric emergencies in my anecdotal experience. And of course, we can see that this plays out in the data on a national and a global level. When I'm talking to parents, I try to help them to understand there are some warning signs to things like depression that we should pay attention to. Of course, this is not an inclusive list, but it's some of the important topics that can include things like excessive sleeping during the day or lack of sleeping at night, frustration that is out of proportion to the cause, agitation outbursts or a change in daily behavior, or even something simple as the child is not interested in normal activities that they were previously interested in. I try to remind parents that these are some of the important signs that we should pay attention to. And the most important tip that I give to them is to trust your gut. We often know that something is wrong before it becomes obvious, so we should use that moment to open up conversation and to seek out help from a provider that we trust.
That's a great point. We do understand each other at a level that we often aren't articulating. So let's talk about solutions. How should these mental health challenges be handled? What can we do?
You know, Terry, I think it really focuses on access, not just access in terms of education, but access to diagnostic testing, access to therapeutic intervention, and access to pharmaceutical interventions. What we have seen in these populations that are incredibly vulnerable that I just recently discussed is that they just simply don't have the access. But there is some cause for optimism because when we look at the research and over 50 years of research on natural disasters, we can see that young adults who are experiencing these distressing symptoms oftentimes are able to cope and go on without chronic long-term mental illness. So I'm hopeful that we'll see the same trajectory in this pandemic, but we have to identify the problem first and intervene.
And intervene and care for each other. Dr. Darian Sutton, thanks very much as always for that.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.